We've made this video for our patients to describe what telehealth is, or eVisits, or telemedicine. Hi, I'm Dr. John Waits, a family physician that delivers babies, leads a residency program, and together with Dr. Lacey Smith, we co-lead a network of community health center clinics in central Alabama. Everyone has been affected in multiple ways by the global pandemic, from the novel coronavirus that causes COVID-19 in ways that have not been seen before in many of our lifetimes. Like you, each of our 350 employees and their families have been affected as well, with everything from elderly parents or grandparents being at risk should they contract the virus, to kids being at home and out of school, loss of a household income, loss of a spouse's job, and concerns about their own livelihood and what might happen in the economy. And of course, the ever-present fear of, will I contract this virus? In case you're wondering, Cahaba Medical Care is still open. We've issued no layoffs. And although we're working creatively with each individual employee and their self-requested reduced hours due to caring for kids or grandparents, we're also experiencing truly heroic efforts of our staff who are showing up for work each and every day with earlier hours and later hours, caring for their community and their patients. So I wanted to take this moment to highlight all that Cahaba Medical Care staff and team is doing to combat this pandemic, as well as to be fully available for each and every one of you, our patients, during this crisis. First and foremost, our primary concern since the utter beginning of this crisis was to keep our patients and our employees as safe as possible. The Centers for Disease Control and the World Health Organization have advised us that this virus is transmitted by respiratory droplets and not primarily through the air, further than a cough or a sneeze might travel, and that hand washing, not touching our face, no handshakes, and maintaining social distance is the order of the day. We've also learned the hallmarks of this virus are fever, cough, and shortness of breath, and maybe even an association with abdominal pain, diarrhea, loss of smell, and significant fatigue and hypoxia. For these reasons, at the outset of this crisis, we began screening every patient, family member, and employee at the door every day for fever by checking their temperature and asking about symptoms or known exposures. We want all of our patients to know that anyone with a fever or symptoms is getting excellent care at our fever and cough respiratory evaluation clinics in 3 different locations: in Centerville, in Marion and Perry County, and in Birmingham at our West End Health Center. And that all of our main locations are now filled with patients and staff who have been screened and are symptom-free. Of course, some people do have this virus before symptoms present. So for years, we've been a Joint Commission accredited healthcare facility that follows CDC recommended infection control procedures. And all of these training protocols that we've done for years have received renewed attention at this time. So we're performing extra disinfection of our countertops and laptops, as well as not shaking hands and keeping appropriately recommended distance as we care for our patients. If you come to our fever and cough respiratory evaluation clinics or get screened into one of those locations, what you'll find is an equally meticulously clean environment. You'll be asked to wear a mask, and you'll see other patients and staff wearing masks in these facilities, which protects you and our staff from contaminating each other while you're being evaluated. Additionally, you'll see the provider and the staff member that will evaluate you the closest wearing PPE, or personal protective equipment. This keeps you safe and keeps them safe in case you have the virus while we're doing the process of discovery. And having our PPE used primarily in these locations helps us be good stewards of equipment that cannot be easily resupplied due to global shortages right now. Despite this extensive and best practice safeguards that we've put into place, some of you are still concerned about leaving your homes for the doctor's office and are wondering if you can have your visit in some other way. The great news is, yes, we've got some ideas for this. Since 2004, we've offered house calls, and we are continuing and expanding these house calls in appropriate circumstances right now. Since 2017, we've offered telehealth or telemedicine visits and are continuing and expanding these. So what is a telehealth or telemedicine visit? At some point or another, you've probably talked to someone or on FaceTime or maybe even Skype. Telehealth is like a FaceTime visit with your regular healthcare provider. So first, let's talk about eVisits. So I mentioned in 2017, we've had a provider on call every single day for a virtual walk-in visit. If you had a health concern, you could go to our website, click the eVisit button, and follow the instructions from there. Once completed, you would join a virtual waiting room, and the provider would connect with you when you were ready. We've enjoyed serving you in this way. And our walk-in nurse practitioner, physician assistant, or physician is still available on a first come, first served basis for these visits. Just click the button on our website. But let's talk about Google Hangouts for regular annual wellness visits, your prevention visits, or your chronic disease visits, or your medication management visits. In this case, you just need to simply keep your scheduled appointment time that's already on the schedule, or call for a regular provider, but call ahead. Let the receptionist know or the medical assistant know that you would like to do a Google Hangout visit. Google Hangouts or Google Meet is a service just like FaceTime. You'll need to go to the App Store and download this on your device. And it's all set to work with the devices that all of our staff use. Dr. Lacey Smith and I, Dr. John Waits, we've created a 2.5-minute demonstration video of what it's like to download Google Meet and have a Google Meet or Google Hangout visit with a provider. That video should be in the link if you just click it. So go ahead and download Google Meet in the App Store on your smartphone. And call us to make an appointment with your provider for your annual wellness visit, your diabetes or hypertension checkup, or any medication management visit that you need. We're here for the coronavirus, but we're also here so that you don't lose track of your chronic disease visit. We know that there's all kinds of other complaints still going on here this spring. So wait a minute, did I say call? How 20th century of me. We have an online patient portal. This is the best way to bypass our awesome receptionist and get directly to your provider's team of medical assistants in the back. If you already have an Athena portal, send us a message today through the patient portal with any questions that you have. If you've never set up this patient portal, again, go to our website. Near where the eVisit link is, you'll see a link for the patient portal. Just set things up there. This is an extremely stressful and even lonely time for all of us. We know that you have healthcare needs that go beyond COVID-19, so please reach out to us. You can call your clinic's main line. You can pause this video right here to find the number if you need it. We also have a COVID-19 hotline that you can pause the video right here and call to see about how to get scheduled for testing at one of our 3 new testing centers that we've opened. Speaking of loneliness and stress, you may or may not know that we have 13 social workers, 6 of whom are licensed counselors. They've been using Google Hangouts for years with some of you for their group counseling visits, and they're doing it now. We've created a hotline for any of you that are experiencing loneliness, anxiety, depression, anything like that during this unique time. Please don't hesitate to call that line and schedule a brief dialogue with one of our counselors, and they'll take it from there. As a final note, we appreciate each and every one of you so much. Now more than ever, we need to pull together as a community, and in this case, as communities. We will make it through this crisis. We're still here as your community health center, your primary care physician office, your patient-centered medical home. Our team of committed healthcare providers and staff, they're showing up every day in truly heroic ways. Please reach out to us. Let us help you with your questions and concerns about the global pandemic, but also with your unrelated but normal acute and urgent needs, your chronic disease and medication management needs, and preventative medicine. And, as your community health center, as a small to medium-sized business, we want to thank you for sticking with us through this. This is a difficult time for all businesses. And as your nonprofit community health center, we appreciate your business now as much as ever. We're truly here for the long haul. We're in 4 different counties across central Alabama, and we love living and serving in our communities.